COVID-19, navigating the new normal. My name is Steve Ash, the Vice President of Account Management for Horan, and I want to thank you for joining us. To say it's been a wild and unique several weeks is probably a bit of an understatement, but I think and hope that most of you have finally settled in. But true to COVID fashion, we can't simply settle in and become complacent. We now need to start thinking how we begin to navigate the post-COVID and reopening our businesses, which is why we're happy to partner with Cigna to recap what's happened and, more importantly, focus on what's coming next. At Horan, we help to catalyze a brighter future for our clients and provide guidance and process to help you achieve more positive outcomes. We understand that is truer at this very moment than it ever has been. For the next 60 minutes, we hope to provide you with peace of mind as we head into the next 90 days and beyond. We hope to provide some clarity as you continue making decisions that are going to impact your organizations and your biggest assets, your employees. I'd like to introduce Jenny Marathu, Product Strategy Senior Director for Cigna. With over 26 years of industry experience, Jenny returned to Cigna in August of 2017 to lead Cigna's group life, accident, leave, and disability solutions. Jenny and her team work to create new solutions as well as enhance current capabilities in Cigna's portfolio of offerings that will continue to differentiate and define them in the market leader. Jenny, we really appreciate you offering your time and your expertise and insights to Horan and our friends. We know you're extremely busy with everything that has transpired. For those that have questions, please submit those via the webinar. We will actually take a few different times to pause to address as many of those questions as we possibly can. Jenny, with that, I'll go ahead and turn it over to you.
Thanks so much, Steve, and thank you all for joining us. Your time is valuable every day of the year, but especially given some of the situations and the crisis that we've been in over the past couple of months. I know that time is of the essence. So as Steve mentioned, my name is Jenny Marathu, and I work for Cigna. And I hope the conversation today starts to transition and starts to get you thinking around what needs to happen over the course of the next 90 to 180 days. I am going to pause a couple of places for questions. So as Steve mentioned, if there's something that comes up through the conversation, by all means use the chat function and the Q&A bar on the right-hand side of your panel. If I don't get to your questions, I've promised the team at Horan that I will double back and do any research where I'm not able to answer something and get back to you all pretty timely. I have my partner Christian with us today, and he'll be navigating the slides. So Chris, let's go to the agenda. So I plan on covering a couple things here today, and it's going to be a wide-ranging conversation. So I do want to hit pause. I know you have all been knee-deep in a lot of the changes that have kind of approached us and that we've had to tackle over the past 60 to 75 days. So I want to pause and not spend a lot of time on that, but I think it's interesting the way that I position it. You'll see really where we've been and then where we are now. Then I want to talk just generally speaking around as you think about bringing people back to work, if you've had to furlough them, some plan provisions that are standardly in many of the insurance contracts that you all have either with Cigna or with any of the other vendors out there. And then also start talking about return to work, accommodations that may need to be made, and some practical tools you can use. And then what I want to focus some time on is mental health. This May is Mental Health Awareness Month, and so from a timing perspective, a timely topic, but also one that I think this particular pandemic is going to have a lot of legs around. Next slide, please. So I want everyone to sit back and just think about this because it's staggering as I go to build some of these presentations and I think about literally where the world was and where we are today. Think about back in March, end of February, beginning of March, we were all going to the doctor's offices, we were traveling. Children were either in college, away at college, or they were in an actual school. We were all sitting around tables and working, and there was plenty of toilet paper to be found out across the land. And so if you think about that, and let's go to the next slide, Chris. In a matter of 15 days, honestly, between 15 to 20 days, our entire world completely changed. So we were no longer traveling. We were homeschooling children, or children were coming home from college. We were working at home. There was no toilet paper, or even today, you may be limited to the amount of toilet paper that you can find or purchase. I found hand sanitizer for the first time in 3 months and bought as much of it as I could. We were sheltering in place, and telehealth, seeing our doctor, became either a telephone call or a virtual meeting that we were attending. And all of this happened, honestly, in a period of 20 days. It's unbelievable to think about it when you look at the pictures before and after. Next slide, please, Chris. And so while all of that was happening, all of you on the phone were also having to adhere to legislative actions that were being taken out across the land. And so there were a ton of bills and laws and acts and orders that we had to implement for many, many, many of the lines of businesses that you have, including your group insurance products, your accident, your life, your health, your medical plans. And I know a lot of you on the phone are covered members from a size perspective. You're under 500 lives. So some of these acronyms are absolutely near and dear to your heart as far as the expansion of the federal family leave, changes to New Jersey and New York, Family Leave Act, and then the Earned Paid Sick Leave Act. And so I applaud you all for having done everything that you possibly can. We have found that many, many, many employers have been incredibly generous and reasonable during this period of time. And so I just want to pause and think about where we've been, and then realize that all of you have had to adjust significantly to the world, the environment, and really trying to take care of your businesses, the customers that you serve, and then one of your greatest assets, which is your employees. Let's go to the next slide, Chris. So as we start to think about, while the world is opening back up and whatever your individual plans may be to either maintain your workforce in where they are or whether your employees actually have to physically come back to work, thinking about a lot of the standard plan provisions that exist in many of the disability and life policies, it's really important to understand how each of these may work. And so keep in mind the information I'm going to cover is really general information. So from an industry perspective, while different carriers may have some bells and whistles or a little bit different of language in some of their standard plan provisions, some of the plans, generally speaking, work fairly similarly across the industry. And so I do want to just make sure folks realize that you want to check your insurance plan, and I'll cover that again and reinforce that again at the end. But I want to try to cover a couple of plan provisions that many carriers have either administratively changed or are adapting given the current time. So one of the plan provisions standardly in disability and life insurance policies from a group perspective is continuity of coverage or continuation of coverage. In essence, what this plan provision does is it protects people while they're out on an approved leave of absence for a set period of time, provided the premiums are paid. Most notably, this typically happens where people are out due to an FMLA approved leave of absence, or where in advance employers have agreed for a short period of time an extended bereavement leave, or some other type of situation where there's an agreement where the employee is going to be out for a set period of time. They won't be at work, but premiums continue to be paid, and it's specifically the time frames are set and outlined in the plan. Traditionally, furlough, temporarily laying employees off, or reducing hours so that employees are no longer part of an eligible class of employees were not considered covered reasons under the continuation of coverage or continuity of coverage provision in most plans. The reality is, most carriers have stepped up and are allowing for this provision to apply while businesses have been closed, while they've had to reduce hours or temporarily furlough employees and or other large classes of employees and groups of people. So in essence, it means that if one of your employees who you've had to furlough or reduce their hours so that they no longer are part of an eligible class, and if their premiums were paid, let's say they were in a car accident or they were doing some fix-it or home improvement things around their house and fell off of a ladder, Provided that premiums were paid and they became disabled, that claim would be considered under the plan, and all of the rest of the disability and or life insurance coverages would persist, provided that premiums were paid and the carrier that you're with had made the decision to cover people in a furlough situation or a temporary layoff or in a reduction of hours. A lot of carriers came out fairly early in this crisis and took the position that they would extend or they would provide continuation of coverage through the end of May. Many have gone out now and granted that in addition to the end of June, and a couple out there have provided that this will continue through the end of August, or they've remained silent and are doing it on a month-by-month basis, and realizing that this pandemic is like no other, and they're having to kind of look at things on a case-by-case basis and or make some decisions as we get to certain timelines and timeframes. Typically, the continuation of coverage provision, and it may be called something different in different plans or with different carriers, applies and is similarly treated for life and disability plans. The next provision that may apply is what's called reinstatement of coverage. So if you think about it, covers a situation where an employee may have remained employed, so in the situation above where they were furloughed, but premiums failed to be paid or some other plan provision wasn't met. So in that instance, if a furloughed employee and or their employer ceased to pay premiums, the provision, which is the reinstatement provision, would allow them to regain their coverage at previous levels with prior effective dates and periods of time when they return to an active class and premiums again to be paid. They begin to be paid again. It's crucial to note, though, that unlike the first situation where premiums had continued to be paid, if there are any claims during that period of time where premiums were not paid, that would no longer then be considered a covered claim. Traditionally, disability and life plans work the same with regard to the reinstatement of coverage provision. But again, just realize that the reality is somebody may still continue to be able to be reinstated if they remain employed. But if they had that situation where they fell off a ladder while they were cleaning out their rain gutters and that disability claim presented itself to the carrier and there was a determination that premiums had lapsed, then that would not be a covered disability claim for the purposes of that plan or that provision. Finally, one of the other provisions is in the event that you had to terminate employees, and then you've decided once you open back up for business that you're going to rehire that employee. There are plan provisions either known as a rehire provision or an eligibility waiting period waiver provision, where it generally allows you as the employer to rehire someone who you previously terminated, and it will provide for credit for all of the time that they previously had met under the plan's eligibility waiting period or any of that time that they were required to serve before they became effective for that plan. The nuance here, though, is typically they have a new effective date of coverage. And so therefore, under some of the provisions, other provisions would apply. Under the plan, other provisions would apply. So for example, if you terminated someone in April and you brought them back in September, they may, because they had been a 10-year-long employee, have satisfied the eligibility waiting period or any of those waiting periods that plans would require. They're able to come back on September the 1st, but they would have a new effective date of coverage of September the 1st. So in the event they were to go out on disability within the first 12 months, as an example, they would be subject to a pre-existing evaluation. So unlike the other provisions that may apply with the reinstatement and with the continuation of coverage, they maintain their same effective date, but they would, in this situation, they have a new effective date of coverage, And so they're not going to have to satisfy waiting periods and things of that nature. But unfortunately, because they had severed their relationship with you, they would be subject to other plan provisions, typically in long-term disability policies where there's a pre-existing provision exclusion, or even possibly in some short-term disability plan policies. Typically, disability and life plans treat this provision the same. However, where disability may have a pre-existing provision to protect against anti-selection, life insurance policies will only allow employees to regain coverage under the reinstatement provision up to any of the policy's guaranteed issue amount, with anything that's in excess of that, requiring an employee to provide proof of good health or evidence of insurability or go through medical underwriting. So these three plan provisions are incredibly important for employers to really understand. You've got a set of trusted partners at Haran that can help you understand what your particular carrier may have with regard to some of these plan provisions. But really, this unique situation has required carriers to do extra contractual types of things in order to really accommodate the situation that we're in. But generally speaking, all three of these provisions to some degree are going to work in coordination or in conjunction with each other as you make some decisions on how and when and where you're going to bring your employees back to work. So I'm going to pause and just see if there are any either questions on the phone or if you want to submit anything through the chat function. And Steve, I don't know if we've gotten any so far. I don't see any there, but I don't want to presume that I have access to all of the same tools that you and your team have.
I think so far so good. I have not seen any come in just yet.
Okay. I'm going to move on then. That's a lot of information, sort of insurance nerdiness, if I say so myself. But hopefully you've been thinking about all of those things with regard to the coverages that you're providing your employees. Obviously, you've got a lot of other plans: dental, vision, medical, accidental death and dismemberment, AI, CI, and healthcare conversations as well. So as just a reminder, make sure, if you, in the event that you've had to terminate an employee, that portability, conversion, or any of those pieces that have been offered to your employees, either by the administrator you might be working with, or if you're responsible for those. All of this stuff is important, and think about, just generally speaking, if you do have questions or if you have to take actions or if you're interested in understanding some of these specific nuances from a plan provision perspective, either work directly through your particular account teams that may be helping and supporting you, and or any of the other resources that you have available to you. So before I move on to sort of the return to work conversation, I want to just make sure that in spite of the world trying to open back up again, simply because states or cities or counties or the federal government have outlined, businesses can and should reopen, it's ultimately up to individual employers to determine what that looks like for them. And most importantly, what you have to always keep in mind is obviously the safety and the security of your workforce. So let's flip to slide 8, Chris. So if you think about, where we've been, think about some of the employees that if you think about the first 2 slides that I showed way back at the beginning of the presentation and the speed with which you've had to move people home. The reality is, generally speaking, people that are working in their workspaces in an office building and then people who are working at home may be sitting on a piano bench or a folding chair, a coffee table, their bar top counter. Some of the things that individuals are working through right now as far as their work at home setup are not necessarily set up for long-term success. And so a couple of things to consider the longer that this pandemic continues, and in the event that you won't be opening back up your offices and you're choosing to continue to work or function in the environment that you've been working in, keep in mind a couple of things that you want to think through. So a lot of people obviously had to move home really, really quickly. And you want to be really, really careful and make sure that you're checking in with your employees. If you're going to keep them at home, what can you do to really think through trying to get as much ergonomic assistance for them that you can? So in the back of the deck, we've created a list of resources. There's a video on how to set up your work at home space so it's as ergonomic as it possibly can be, and some tip sheets that also include some aids and some guides and very low cost, using a stack of books to raise your monitor, adjusting your chair, using pillows or other things in order to support your back. And so just realize that a lot of repetitive stress injuries, pressure-related injuries from prolonged sitting, visual strain, all of those things are apt to happen in our regular work environments, but are probably even more apt to happen in the event that people have had to move home really quickly. So by all means, use those resources, and many of your carrier partner vendors also have resources or tips or information and support that you can use in order to provide employees with possibly the best ergonomic environment that they can have at their home, realizing obviously that a lot of equipment that people would normally find plentiful at this point in time because of the millions and millions and millions of people that have had to move home. Unfortunately, some of this stuff is just not available, although hopefully coming back online pretty quickly here. The second thing to keep in mind is people thrive with some people face-to-face interaction or human contact. And if you think about some employees who maybe live alone, their only interaction was with the coworkers that they saw on a day in and day out basis. And they may have spent not only work time with those employees, but Friday nights, weekends, picnics, barbecues. And so it's really, really important to make sure that your leaders and you and your teams are creating virtual moments. So it's for all of your employees, but especially for those employees who are really, really the only source of social contact that they're getting is primarily through work. So Cigna's obviously done a vast amount of research, even prior to coronavirus, on the impact of loneliness in society today. A more recent study was actually done on a lot of millennials and the millennial population and how lonely and socially disconnected that population or that generation is. And the reality is that mental health, the mind and the body are incredibly, incredibly connected. So make sure you have a plan and you're working, if you're not bringing employees back into the workforce, and even if you are, their ability to socially interact either outside of the workforce or in the workforce is going to continue to be limited. And so trying to create moments or times where people can socialize virtually is incredibly, incredibly important. As with anything, lots of employers on the phone today have recognition programs. So whether that be moments that matter, whether that be small gift cards, emails, notes, just as with anything, your employees have, if you've remained open and if you've continued to provide services and goods to the customers that you serve, they've been under an incredible amount of stress. Personally, having to shift their lives, but then continuing to work in an environment and provide the services. And so it's really important at this moment in time, and it sounds very simple, but to really use and maximize all of the recognition programs that you have, realizing that people are delivering in an incredibly adversarial time, and so really maximizing some of those programs. If you think about prevention, and if you think about all of the money that you and your company spend on health and well-being, and then think about the utilization. Typically, employee assistance programs get between 0.5% and 1.5% utilization on an annual basis. And think about the amount of money that you're spending and or the return on the investment that traditionally those types of programs get. And so if you think about loan assistance, Livongo, Happify, financial wellness, life assistance programs, employee assistance programs, now is probably a great moment in the event that you haven't to remind workers what programs you have, very simply and easily provide them with access to those programs, and really try to maximize the use of employee assistance programs, and that's going to become incredibly important for the last part of this conversation as far as mental health is concerned. And then the final piece is, whether people are staying at home or whether you're going to consider bringing people back to work, overly communicate. And so even when someone sees on their local news that Joe's Bar and Grill is open, the last thing you want them to do is to show up at work when in fact your office or your organization has made the decision to not come back into the office. And so really be mindful of how often you're communicating, what you're communicating, and then make sure that people understand exactly what's happening with them, with their teams, etc. Also be mindful that a lot of times in group conversations, people are not going to be comfortable raising some of the questions or the concerns that they have. And so it's really important not to only to do group types of conversations and meetings, but obviously take anything away and really make sure people understand that there's safety and that ultimately you're going to continue to balance their safety with local regulations and things of that nature. Next slide, please. So obviously, there's a ton of information out there right now. And so it's amazing the speed with which people, either carriers, the Department of Labor, the CDC, the EEOC, all of those areas have done a really fantastic job of really providing a ton of content out there. So I pulled just a couple of things with regard to what employers should start thinking about if they are going to open up their offices, their places of work, their schools, their businesses again, what employers really need to be mindful of. And so none of this is going to be earth-shattering, but just to cover a couple of quick things. Think about the requirement that you as employers have of really making sure that you're providing employees with a safe place to work. And so I'll cover at the end, unfortunately, these moments in time bring out the best in people, but it also is going to be a really challenging time for you as employers to determine really what is a safe place to work and what do you have to provide in order to ensure as much as you possibly can the safety of your employees. And realize what that means today and what it meant 60 days ago is completely different. We were not talking about face masks in an office environment 60 days ago. So think about, generally speaking, what type of protective equipment you're going to have on staff, available to your employees, whether it be gloves. Obviously, disinfectant is not easy to come by right now, but generally speaking, from a CDC perspective, whatever the guidelines have been around constant and continuous cleaning. If you think about your workplaces and think about how close or far apart your cubicles are, many organizations out in the world today were moving towards these shared spaces and touchdown places and places where people like Google and Facebook could create and all of those things. Well, now what will be interesting is to see all of the partitions that get set up in between all of those lovely, beautiful, colorful living spaces, signage on the floor telling people, as they do in the grocery stores, the stickers that are on the floor, one way, and then social distancing. Obviously, thinking about all of the travel that your employees may have to have done and what's really going to be required now. Considering staggered start times or having only certain entrances of your building before people entering the building, and then other locations in your building only for exiting the building. on-site daycares, gyms, cafeterias, break rooms, you may have to close all of those just because you're trying to prevent employees from congregating in shared spaces and or using shared spaces without the ability to constantly be cleaning all of those shared spaces. And then considering, depending on where the industry is going, thinking about whether or not ultimately long-term you don't want to hire or invest in a third-party organization, either temperature check or temperature test employees as they're showing up for work, or really truly building out a comprehensive return to office program as the entire, this will create an entirely new generation of products and services that a lot of people are going to be providing, and you'll have to make a determination, generally speaking, whether or not that is the right thing for you and your business. So obviously, once you've determined what you're going to be doing as far as if you're remaining and keeping people at home or as you're opening up your organization, communicating that, making sure if employees are fearful of coming back to work that you've outlined exactly how you're going to help them or exactly what precautions you're taking in order to keep them well. Obviously, it's a no-brainer. We were telling people this before coronavirus, but if people are not feeling well, they should stay home. And then really think about developing really, really formal return to work or safety and security programs and requiring all employees to go through those programs and making them mandatory. So at least you as an employer are protecting yourself as much as you possibly can to making sure employees are all aware and understanding of not only what you're doing to keep them safe, but also what they're responsible for as far as public health safety pieces and obviously not showing up for work if they've got a fever or a temperature. Lots of information is out on the CDC website. I've included a lot of the links at the back of the deck. None of this, again, is earth-shattering, but there's probably a couple of pieces in there that you really need to think through as the world opens back up or tries to open back up again and you make decisions on exactly how you're going to be bringing your workforce back. Next slide, and then I'll pause. So obviously there's a lot of conversations right now about ADA accommodations. And so one of the interesting things, and just to remind people, if you're an ADA covered employer, it's generally speaking, I would believe most of you on the phone are an ADA covered employer. So if you have 15 or more employees, including state, local governments, public agencies, all of those types of organizations, you are covered under the ADA. And there's a vast amount of information out there on the EEOC website and Department of Labor websites, significant amount of content, frequently asked questions, and general guidance. A couple of specific examples or a couple of specific questions that have come across there, and I'll cover them. I'm not going to just read and repeat it, but generally one of the things you might be asking yourself is, am I legally able to take someone's temperature? So can I flash someone with a temperature gun? Everyone needs to realize taking someone's temperature doesn't necessarily mean they do or they don't have coronavirus, right? So a high temperature could mean that they have something else going on, and no temperature doesn't mean that they don't have it. But the reality of the situation is, generally speaking, it's a visual safety net for people coming into the organization. But generally speaking, the Department of Labor and the EEOC have determined that you can, because it's an acknowledged community spread of coronavirus, you can take the precaution of measuring an employee's body temperature by taking their temperature, and that can be something that is considered okay, and people would have to go through in order to enter your facility. Another question that people may ask are, whether or not they have to have modified or they can't use the regular gear. They need to have latex-free gloves or things of that nature. And must you grant employees any of those types of requests? And so while you can require employees to wear protective gear, so masks, gloves, etc., and make sure that they're observing all of the control practices. If there's an employee that does have a disability and they're asking for a reasonable accommodation under the ADA, so for example, a modified mask, or some type of a different, glove or things of that nature, you really do need to determine whether or not you're able to accommodate that, if it's a reasonable accommodation or modification, or if it would actually provide you as the employer any type of an undue hardship. So it's imperative that you think about this from a case-by-case basis, but obviously it's probably in your best interest to think about what are the most likely things that people are going to ask for, so latex gloves being a great example. And if in fact you're going to require the use of gloves, think about the reality that there is a huge amount of people out there that have latex allergies, and so you may just want to automatically consider the use or a supply of non-latex products in the event that you're going to be bringing people back to work. A couple of other of these things. What about the employee who is fearful because they have pre-existing conditions on being able to come back into the workforce? So if you think about, I have a pre-existing heart condition or I have asthma and I'm concerned about going into the workplace and I'm fearful of going back to work because of that. Again, a reasonable accommodation may be that you allow that employee to continue to work from home, provided it doesn't provide you with an undue hardship. But realize that a lot of the accommodations or the things that many, many businesses are doing right now as far as plexiglass, tables or barriers to minimize distance between your customers and or other coworkers, those are all very, very reasonable accommodations, but they obviously don't speak to a lot of the underlying issues that employees are going to be fearful of as they're coming back into the workforce. So I would continue to encourage you to use very, very strict accommodation protocols with regard to the requesting of an ADA accommodation and really making sure that you are looking at each and every one of those on a case-by-case basis, using the resources that you would traditionally use and making sure that the application of your ADA process is administered consistently and congruently across all of your business lines. So you want to make sure that your managers know what are some of the keywords that people are going to be saying when it comes to, well, I would love to return to work, but, or I can't come back because. You need to really make sure people are not just making decisions one-off, because then you're going to run into a situation where someone has accommodated an employee in one department, and if not done correctly and consistently across all of your business units, perhaps and fundamentally they may not have done, consistently managed it on the other side or with another employee, and that's the last thing that you want to get yourselves involved in. So before we move to the next slide, I thought I would pause, see if there are any questions around return to work, stay at work ergonomically, if there are any issues or challenges you're experiencing, and or if you think about what's going to happen as you start to bring people back, the natural fear and some of those things are going to start to present themselves, how to handle those situations. So I'll pause and see if Steve or Chris or anyone else has anything to add and or anything that I want to address right now.
Yeah, we had somebody ask about, do you have any ideas on how possible workers' comp claims may be handled if people experience strain due to the home office that you talked about previously?
Yeah, great question. Great question. And so there actually is quite a bit of legislation out there right now, generally speaking, around the transmission of coronavirus and whether or not and how you're ever going to be able to trace it back to a workplace. So whether or not those would be considered or not considered workers' comp claims. But generally speaking, if an employee is set up at home and they experience issues or challenges from a work-related injury perspective, that usually and typically would be considered as part of your workers' compensation. So they are work-related claims, whether they're working at home or whether they're working in if they're performing work on behalf of your organization, which is why it's so important to make sure that you're doing everything that you possibly can do, given the fact that honestly people were sent home and are probably not working in the most ergonomic of situations. But from a workers' comp perspective, I think there's two paths here. One, if they're experiencing issues or challenges while they're at home, it's going to have to ultimately then be reviewed probably in alignment with from a work-related injury perspective. But separately, there's the conversation that's happening right now in different states, and legislatures are trying to determine how to manage this on if you actually do contract or are alleging that you're contracting coronavirus in the workplace, how they're going to trace that back and how that could possibly and potentially be a work-related injury as well.
And then I know a few people have been asking about the slides. We will make the slides available so they will be posted to Haran's website, and we can also make sure that we send them out. So just want to make sure that's clear.
Okay. Anything else, Steve, before I move to the last kind of chunk of information?
Nope. I think we can go ahead and move on.
All righty. Let's go to the next slide, Chris. So the final topic, and I mentioned at the beginning of the session, is May is Mental Health Awareness Month. And Cigna, which purchased Express Scripts a couple of years ago, has recently done a study. And it shouldn't be shocking, but it actually is shocking when you actually look at some of the results. So they did a state of mind study. It is available out there. It's at expressscripts.com, America's State of Mind report. It's a very, very comprehensive report. I would encourage you all, if you have any interest in the well-being and the mental state of Americans today, to go out and grab it. I think you have to put your name and email address in it, and then they'll make it available to you in total. But one of the things that they did add to the report, which was just published in April, is they did add a coronavirus insert into it. And so the shocking part is a very early analysis by Express Scripts shows that the number of prescriptions that were filled per week for antidepressant medication, anti-insomnia, and anti-anxiety increased 21% between February the 16th and March the 15th. So think about it. On March the 11th, the World Health Organization declared coronavirus a pandemic, right? So that happened on March the 11th. And all around that time, you saw scripts skyrocket for those conditions. What's really interesting, though, is that this is in direct conflict because the use of a lot of those anti-anxiety medications over the past 5 years had seen about a 12% decrease. So this wasn't a trend where it was on the rise, on the rise, on the rise, on the rise, and then all of a sudden this shot it up past, into the stratosphere. This is honestly a situation where it had actually been on the decrease. And so it's something that we absolutely need to consider seriously for a lot of the reasons that I chatted about, the loneliness piece, the anxiety piece that people are going to have in coming back to work. But generally speaking, there's obviously a huge connection between mind and body. And so as people are experiencing anxiety, they're probably not going in to see their doctor. They're probably not getting their routine treatment. And so again, at the end of the day, ultimately the tail on this conversation, especially if you're an employer that has first responders and clinicians, the front lines, the PTSD is really going to be something that we need to watch and really get our arms around pretty quickly here. Next slide, please. So what can you do? I mentioned a little bit about this at the beginning in one of the first segments was really around, if your employees are continuing to work and they're working from home, making sure that, or when you bring them back in, right? So this whole situation is not going to ease itself for quite a while. And so whether they're continuing to work at home or whether you're bringing them back in, really thinking about training your managers or reminding your managers on how to try to identify employees that are at risk really early. So think about the employees that you have had to furlough, and did you provide them with any emotional support or resources when they were being furloughed? Have you made, are you aware of any concern that your employees have raised that you would automatically want to, step back and think, oh, I wonder if there are some resources that I can provide you with? Are your employees struggling if they're working currently, to maintain their work, or are they expressing a concern for someone else on the team? Those would generally be good mechanisms in order to determine whether or not you should be, using or, helping people to get to the resources that they need. Ask some of your vendors if there are other things that they can provide you with. So at the back of the deck, I've provided a ton of access. Again, there is no limitation of information out there. I just put down what Cigna has available. I don't want this to be a Cigna commercial, but there are no limitation of resources that are out there. Cigna has put a lot of podcasts, extended information, tip sheets, all of that stuff is out there in one place, but your vendors and your providers also likely have a ton of information out there. And so really making sure that you're engaging your team. So how are your teams feeling? Seek feedback from diverse groups of employees about how are you feeling? Are you concerned? Are there other resources that we can bring in? Can I bring someone in to talk to a large group of people before you bring them back to work? And so really think about the mental health challenge and try to increase, right? So I mentioned that utilization across EAP programs, generally speaking, is pretty low, less than 2%. Try to use this as a moment, or challenge your teams to use this as a moment to actually use those resources, to get the added resilience that they may need, and generally, possibly honestly change a curve with relation to this. Next slide, please. So the reality is, I did some research, and this is back a couple of days ago. There were about 68,000 deaths as of May the 4th due to coronavirus, and about 1.5 million confirmed cases that have either been exposed and are with more obviously having been exposed and are non-symptomatic. So the chances that you have an employee that's been directly impacted by this is obviously an absolute possibility over the past couple of months. But the transparency and the reality is that experts are anticipating a wave 2 and a wave 3. So think about the situation where if you have an employee that has passed away, what resources are you providing to either coworkers or your managers, and how do you deal and handle that situation? They need to be really, really in tune to conversation groups of employees are having, either in a group situation or one-on-one individually, where if there are concerning comments that employees are making with regard to self-harm. I know all across the news there have been a couple of very, very highly publicized cases of physicians committing suicide. And we all know that suicide, generally speaking, before this crisis was on the rise. And so really make sure your employees and coworkers are sensitive to the fact if employees are mentioning self-harm, or if they're completely removing themselves from situations, be really, really concerned around that, and reach out, find out what's going on. Obviously do so incredibly delicately, because all of these situations are really highly protected conditions. But make sure you are interacting with people so that you don't have a situation and or are providing resources in advance of it. Also be really concerned with people who are now sitting home. There's the cute little baby on someone's lap at the beginning of the presentation. It would be lovely if that's what life really looked like. Chances are probably good that that's not what life looks like. Let's just be real. And so thinking about people who are working at home, telecommuting now, taking care of their children, trying to teach them algebra when they themselves perhaps struggled through algebra way back when, and generally they're burning the candle on both ends. And so think about what you can do from a mental health perspective or from a work perspective to support those employees. So if you don't have employee resource groups, now may be a great time to get one together so employees outside of the purview of a manager can start having open and candid conversations around how they're feeling. Next slide, please. So finally, to wrap it up, and then I'll grab any last questions or any additional calls for resources. So I know you can't walk through a grocery store right now without someone saying, we're all in this together. But make sure you only go one way down the grocery store aisle. And honestly, this is where, in these moments, the best of people come out, but it's also a time when there's a really small portion of the population who's going to try to take advantage of this situation. So whether it be selling you services and goods, that may be faulty, or whether it be, trying to provide you with services and goods that you don't need. Rarely at a time in our lifetime, unless you were working back in 1917 or 1918, right, when the Spanish flu, kind of went rampant across the land, rarely have we lived through a time like this. So many other medical challenges or threats to our country have come and gone. But the onset of this one and the lingering tail on this one will have far-reaching implications to businesses, employees, generally our world. While everyone's doing the best they can, be mindful of the decision that you're making and the decisions that you're making, consistent application and clear communication. Employers have risen to the occasion. It is unbelievable the generosity, flexibility, and just general accommodations that employers have made. They have done everything that they possibly can, I think, to cover, protect, take care of not only the customers you're serving, but also your workforce. So you should all receive a round of applause, but just be really, really mindful of when you're making decisions. And then, again, getting back to the ADA conversation, no good deed may go unpunished. So realize that documentation and all of that stuff really needs to, in this moment, probably be even at a higher level than normally in your day in and day out basis. Coronavirus is going to become an emotionally charged conversation. So if you think about, when you call and you're not able to travel normally, there's not a lot of latitude there, and it's like you got to pay a $200 change fee. Now when you add in this, well, but I have coronavirus, or why won't you protect those people given what's going on? It's going to become a really emotionally charged conversation once we get through this first phase. And so again, think about the reality that there is a lot already. I just did one small search that said coronavirus and class action lawsuits, and this is what popped up. So I'm not suggesting, I'm just saying that I think that, again, at the very first bullet, unprecedented times, and it's bringing out the best in many, many people, employers, companies, all of those types of things. But at the same time, it will be a moment where, unfortunately, if not done well, or if not done right, or even if done well and right, there's situations where there's going to be legal actions or questions or concerns or filings and things of that nature. So I provided a resource sheet on the very back of the deck. It's got a lot of Department of Labor, et cetera, resources. Obviously, anything that's on here, free of charge. There's amazing resources out there all across the land. Just poke around. Many of your suppliers are probably providing great content. I thank you for your time and your attention. More than happy to answer any questions related to the mental health stuff and or anything else that we've covered throughout the content of this presentation.
I think somebody was trying to get a little more clarity on the workers' comp piece, and they asked, wouldn't the burden of proof be on the employee if they claimed workers' comp?
Oh, absolutely. Yes. Yeah. So if I didn't make that clear, yes, absolutely. But realize if their work environment is at home and let's say they're not ergonomically set up and they get neck strain or neck sprain, they would follow through that same exact process, but their home environment, if that is then become where they're supposed to be working at, the same laws, provisions, et cetera, would apply as if they were in the workforce. So hopefully that answers it, Steve.
Great, thank you. I haven't seen any additional questions come in, so if I see one in the next little bit, I will let you know. But just a couple closing remarks from Haran. We will email the CE certificate and presentation by the end of day tomorrow. We just want to thank everybody for your time today. We understand that you're busy. Many of you are actually probably working on figuring out return to work policies and procedures. So again, we hope you found these last 60 minutes helpful. If you have any additional questions, need guidance or assistance with anything, you can always reach out to your Haran team, who's going to be happy to help. And Jenny, I don't know if you have any other closing remarks.
I don't. Just thank you for your time. I hope at least one or two pieces here was helpful. Thank you for inviting us.
Thank you. And thanks, everybody. Have a great day.